Today we are going to discuss about another very common disease which is caused by the deficiency of vitamin A or retinol. On the world scale, it is one of the most common cause of blindness, and according to WHO, that around 255,000 children become blind because of vitamin A deficiency. So you can understand that how much impact it occurs in children. If you come to the dietary source, vitamin A or retinol mostly found in animal foods. However, herbivores get this vitamin from its precursor, carotenoid pigment in plants. Beta carotene is converted into the retinol on the wall of the small intestine. Only 30% of beta carotene is converted into the retinol efficiently. The main source of retinol are milk and butter, or liver, egg yolk, and some fishes. Fishes are the main, or you can say the richest source of vitamin A. However, it is not used as food. It is used as a nutrition supplement. And for the carotene, it basically found in green leafy vegetables and yellow and red fruits and red palm oil. Recommended daily intake of retinol is 300 mg for infants and the children, and around 750 mg of retinol for adolescents and adults. Retinol is a very essential component of rhodopsin, on which rot vision in dim light depends. If there is a deficiency of the vitamin A, there is an impairment of for dark vision, and that cause night blindness. This disease is very common in the countries which is underdeveloped, and it is also occurs due to malabsorption syndrome in affluent countries. The another disease which is due to the deficiency of vitamin A is xerothalmia. Xerothalmia is basically abnormal dryness of the eyes, especially conjunctiva and cornea, with Bitot sign. Bitot sign is an accumulation of the keratin, especially around the cornea. It is oval, triangular, or sometimes irregular in shapes. Bitot sign are very common in children whose diet are lack of vitamin A. Bitot spot is very common in children whose diet are lacking of vitamin A. When the Bitot spot spreads towards the cornea, it takes on dull, hazy, and lackluster appearance because of keratinization. Now, the another disease which is caused by the deficiency of vitamin is Kerato Malaysia. This disease is very common among Indians or people eating rice around the Asia. It is also occurred in Middle East, Latin America, and some parts of Africa. In Europe, this disease is very, very rare. Children between 1 to 5 years is mainly affected because of this disease. And this disease occurs on a person who are living on a diet for a long period, which is a lack of vitamin A. This disease is also very frequently associated with the protein energy malabsorption. The early manifestation of the disease is xerothalmia and night blindness. And later on, when this disease spreads towards the cornea, it inflamed and necrosis the cornea, and because of that, complete blindness occurs. If the proper treatment is not given at an appropriate time, the patient may get complete blindness or may sometimes die. If you come to the treatment part, immediately after diagnosis, we have to give 60 mg retinol. Spalmitate should be given orally. And second, we have to treat the underlying conditions such as diarrhea, dehydration, protein energy malabsorption, and other nutrition disorders and infection. Pregnant women should be advised to eat green leafy vegetables because it accumulates in infant liver and and because of that, the proper storage of retinol are there. Children are advised to intake green leafy vegetables and keratin-rich foods. Countries where the Kerato Malaysia is the main cause of blindness, or single prophylactic 60 mg retinol may be given to the young children. So this is for now. If you like this video, please subscribe and hit the notification bell so that you will get my latest video on time. So till now, thank you and bye-bye.